Welcome to the Dr. April Jasper Show, relevant conversations for business owners of today. Alcon Water Innovations is a proud sponsor of the Dr. April Jasper Show. Water is integral to our lives and to the technology that makes Alcon Water Innovations contact lenses. Personally, I wear Dailies Total 1 because they feel like nothing. With a portfolio that also includes Precision 1, Precision 7, and Total 30, it's easy to reach for Water Innovations lenses for my patients too. Talk to your Alcon rep today and be sure you're getting the most out of Alcon's Water Innovations lenses that translate to all-day comfort. Welcome everyone to the Dr. April Jasper Show. I'm excited to be here today in Palm Beach Gardens with Dr. Jill Rodila. So Jill, thanks for being here with me. I love that you let us invade your beautiful office and spend a few minutes with you.
Pleasure. It's a pleasure to have you.
So what you guys don't know is this office is brand new. It is absolutely beautiful. You're going to have to come in and see her. But first you need to get to know Dr. Rodila. So I want to ask her a very special question because I don't know if you remembered until I told you that the first time I met you, let's see, it was, I don't know, was it maybe 20 years ago? It was a long time ago.
It's a long time ago.
We both look amazing, but it was a bit ago. And she walked into my office, y'all, and we started talking, and I don't know how it came up, but somehow I learned right away that not only is she amazing as a cataract surgeon and ophthalmologist, but she's also an accomplished harpist. And so the way that conversation goes, do you remember any of this at all? Kind of?
Only when you refreshed my memory the other day, yes.
So she starts telling me all about this and how she put herself through medical school with the money that she made from, I call them gigs, but I should call them something much more professional but playing your harp. And I said, well, you know what? Allie needs another instrument. The piano is not enough. And you said a harp would be perfect.
Yes.
So we bought Allie a harp. She thought, when I said, do you want to play the harp, sweetie? She thought I was going to come home with one that went on her lap. But as you know, they're not quite like that. So here's my question for you. When you go to a dinner event and somebody asks you what you do, with all these many talents, what do you tell them?
Oh, I definitely tell them that I'm a cataract surgeon. That's what I do most of the time. So that's what fills my life, and that's the one-word answer.
Okay, so take us back. What made you go into medicine and specifically ophthalmology? Kind of take us back to the beginning and then weave in music. How did music shape all of this?
Well, during high school, I was very interested in becoming a doctor, but I was very actively learning to play the harp and playing gigs as well, even during high school. And but I knew I wanted to be a doctor, and I thought I would be going into primary care, maybe practicing in a rural area. That was really the push at the time. And I realized that I enjoyed the surgical subspecialties. I enjoyed using my hands. Yeah. And there's just that parallel with playing the harp as well, that I knew I had great manual dexterity and skills. But also there's enjoyment in fixing a problem and not just prescribing medications. So I knew that I liked the surgical subspecialties.
I love that. So it's been a few years since graduation, and there was a journey along the way. So tell us as much or as little about that as you want, but then where are we today and how did this happen?
Oh boy, well, so this practice happened just through experience. I've had experience working at different clinics and out of different offices, and I just had this dream to do things differently. And so you walk in the office and immediately you know I've done things differently.
It's beautiful.
So it's come down to wanting to make it a great patient experience. Yeah. Just something different where, you know, people really care and people are giving you the very best experience, very best equipment, greatest treatment that you can get. So really wanted to give this elevated experience from the moment that they step in the office.
I see it, and I absolutely believe you are there. I can't wait to see it grow and see you be able to bless more people, Dr. Rodila.
Thanks.
Well, let's go to that whole idea again of you being a harpist. So I doubt most people picture a surgeon sitting down to play the harp after a long day in the OR. How does music still fit into your life as a surgeon? What does that look like?
Well, when I have something to play for, then I practice.
Yeah.
So that's what I do nowadays. I'm just so busy. Life is just so full. But that gives me purpose and reason to make it a priority at that time to have something to play for. But the interesting thing about harp and eye surgery is there's a real overlap.
Ooh.
It's almost like playing the harp was cross-training or preparing me for my life as a surgeon. So playing the harp involves using both hands and using both feet. And so does cataract surgery. So
wow, I love that.
With cataract surgery, you have one foot that operates the microscope, and there's different paddles on that microscope pedal to operate the focus, the zoom, the location of the microscope. And then you have a foot pedal that you use to work the phacoemulsification machine, and you use audible sound to hear where you're at with that foot pedal, how much aspiration, how much phacoemulsification that you're adding. And it's shaped like a gas pedal, but to learn or to know where you're at in that gas pedal depression of the pedal, you hear the auditory sounds. Wow. So with the harp, I play the pedal harp, which has 7 pedals at the base. I'm sure you're familiar with that.
I am, but they aren't. So please tell our listeners.
So the harp has 3 pedals for the left foot to operate and 4 pedals for the right foot to operate. And each pedal has 3 different positions. There's flat, natural, and sharp position. And so my feet could be very busy depending on the piece. If there's a lot of accidentals in the piece, then my feet are busy adjusting these pedals and having to know exactly where they are at the base of the harp. So it could be as little as no pedal changes during a piece, or it could be as many as, I have a piece that has 60 pedal changes. That's a jazz piece. So it keeps both hands and feet busy simultaneously, doing it all at the same time. So I feel like it was just cross-training, that I had as a kid growing up and learning to play the harp and not knowing that eventually I'd be an eye surgeon that would have amazing parallels.
Wow, that's incredible. I mean, you never think about that, and I think most people don't know what a grand harp, is that what they're called, the grand harp?
Concert
like
grand
piano,
harp would be the largest harp.
And how large are they?
Well, they weigh generally about 85 pounds on average, and they have 47 strings for the concert grand. So it's a large instrument to have to lug around in a vehicle.
So you know this, but I doubt our audience does. When Allie was going around with her harp to events, we had to choose our vehicle based on what would fit a harp.
That's right.
We looked really funny and sounded, I'm certain, even more funny when we went to a dealership and said, but can we fit a concert grand harp in the back of this?
Right, right. No, we use our measuring tape to see what vehicle can actually work with the harp. So definitely.
And you have to be strong too, because you're the one carrying it around.
Right. Yes.
It was amazing. I admit, you didn't give me all the information when I chose the instrument for Allie.
Didn't want to scare you. It's worth it. It really is.
Oh my goodness, it's beautiful. And just even when you're playing, you look beautiful. I mean, that's something that we never anticipated, is just watching her play just brought tears to our eyes.
Yeah.
We are grateful to have OcuSoft as a sponsor of our show. Since 1986, OcuSoft has served the community with a unique selection of proprietary brands, from dry eye care and protection with Retain line of artificial tears to eyelid hygiene with OcuSoft Lid Scrub eyelid cleansers essential for maintaining healthy eyes. Zoria Skincare from OcuSoft offers revolutionary products for people with sensitive skin and eyes. Thank you to OcuSoft for being the #1 doctor-recommended brand of eyelid cleansers and providing patients and doctors with products and supplies to continue to keep our eyes healthy.
Yeah, that's a neat instrument.
Tell me more about how you feel like, I'm not a musician. I understand that I love it, to listen to it and to watch people sing and play their instruments, but I don't understand always how it impacts our thought process. And I know you've mentioned the fact that maybe even in your office, you'll have harp music. You've had some ideas about that. What do you think that might look like?
Well, I think that music can help people with relaxation, taking the edge off. And so I think it is important to use that, especially in an office where we're thinking about surgery and it's a scary thought to people. So having that in the background, as well as a beautiful environment, relaxing colors, it all kind of ties together in trying to make the experience better for the patient. And I am looking into recording myself play so that I can use that at least in the phone for the phone when you were on hold to hear that, and maybe in the office as well. We'll see.
I love it. So I didn't mention to everybody, in addition to being an ophthalmologist and a harpist, you are I would call you a philanthropist. You're also mom. You're also a wife. You have an amazing family. Now you're a practice owner. What in the world? How has this been fun, challenging, exciting, and what are you most looking forward to in the upcoming years as a practice owner?
Well, it has been challenging and it has been fun. You're right. I've learned a lot along the way. So it's been interesting to see how much there is to learn. You really can't get bored. So there's always something exciting around the corner that you don't know is going to come up, and you need to almost become an expert in it, right? Or take care of it and handle it. So it's exciting also to have a vision, to have a dream of what you want to create, and find out how now can I make this happen? How can I lead this practice to make my dream become a reality with my staff, and make it happen for patients and have them be an extension of me and create that dream that I'm looking for. So that's what I'm looking forward to seeing happen. And it is a process that we're making happen every day. We're seeing it come to life.
Absolutely. So, I wrote the book, Creating Your Business of Distinction. Part of that journey for me was exactly what you're saying. We bought our practice, we started to build it, we started to see how we wanted to do things different, David and I. And we wanted to make certain, and I know you and I have talked about this and you feel the same, that when patients came into our practice, they didn't leave just seeing better, but they left feeling like their life was changed for the better. And so that's been a dream of ours, is to help more people to see that the real joy in going home at night is to be able to control all of those pieces and all those elements and making certain that experience is incredible. So as you've looked at your dream and putting the practice together, some of it's already happening. So patients are coming in, you're building your business. What might be next? Is there anything you're still thinking that you want to implement? And what might that be? Or do we need to leave it a secret and talk about it next time?
Well, I think seeing, so my practice specialty is cataract surgery. And so I am excited to see that be able to do this from start to finish. And so part of that is equipping my office-based surgery area. So I have it already ready to go, excited for that to happen, because then I can really offer the best elevated experience throughout the entire process, and continue to have that experience in an environment, again, that's focused on being comforting, being peaceful in sounds, in sight, and in people that are taking care of you. So that's really kind of the next step.
I love that. And I think that, with a sister that's a doctor and a brother-in-law that is, and another brother-in-law that is emergency room medicine, I just think that it's kind of sad that they're amazing, but there's a lot of places you can go for medical care and it isn't what you would describe as amazing. So to see you doing this, Dr. Rodila, is incredible. All right, so I've got another one for you. What is the biggest myth about women in medicine or surgery that you'd love to bust wide open? I know that's a crazy question, but
it is a crazy question. I think there's a myth that's also true, and I think that myth, but that can be true, is I can do it all, or I all by myself. Basically, I can do this. I can take this on all by myself, which to some extent is true. Some things we need to do all on our own and just do it. But the wisdom is knowing when it's a myth, that I need help
Right.
and I need a team and I can't do it all and I'm going to get help so I can keep my priorities straight, or not do it all and be able to focus on what I do best and let the rest of it go. So that's kind of a creative way to answer your question of something that can be a myth but can be half true.
It's good. I agree. I love that. So what would you tell a young woman, maybe pre-med, maybe in residency, who's trying to figure that out, how to have a full life and a medical career?
Mm-hmm. Well,
don't you have some people in your family maybe in that direction?
So I think the important thing is to find a mentor that can help you along the way. Someone who's already been there, already done that, because life balance is a challenge. It's not easy to set those priorities straight or just to know what other people have done to make it through. So there are going to be challenging moments and times that are difficult, but having a mentor to walk through that with you and get advice from is super important.
And I think some of the advice they're going to ask you for is, how do I have it all? And you sort of mentioned that earlier, but let's ask it a different way. If somebody said to you right now, which I guess I'm somebody, Dr. Rodila, you have such a beautiful practice, a wonderful family, so many amazing things I see about you and what you've done. How can I do that?
Well, I think it's some of it's God's blessing, and it's not all what I can do, but what He's blessed me with. And I think what gives me meaning and purpose in it all too is just knowing that I'm doing what He's given me to do. Like, I feel this peaceful contentment knowing that I'm doing what He's created me to do.
Yeah.
I'm in my lane of purpose, and that's what's fulfilling to me. And that means loving my family, loving my staff, loving my patients, and doing that through the avenue of medicine and cataract surgery.
That's good. All right, so people are going to hear this and they're going to say, where is this amazing practice? And how do I find Dr. Jill Rodila? So tell us where we are, how do they find you, and if they need cataract surgery, how do they reach out to you?
Sure. My practice is called Rodila Eye, and I am along PGA Boulevard in Palm Beach Gardens, Florida. And I am near the Gardens Mall, and I would love to see someone who wants to refer patients. That'd be great.
Thank you so much for doing this. I'm so glad everybody gets to hear your story and a little bit more of my story too, because it's intertwined, and Allison's story as well. So can you imagine if you wouldn't have walked in the door that day, she would not have a harp and her life would have been completely different. So if I can leave you with something, it is thank you for being a blessing to us.
Very sweet. It's amazing the influence that a person can have, and you don't even realize it until years later, or may never know it. So that's great. Thanks.
You're welcome.